is my great pleasure to host today for the Ask the Author session Dr. Yiming Peng-Winkler. He is currently a postdoc at the Laboratory for Tumor Evolution and Metastasis in Leuven, and is moving to Düsseldorf to become a lead of his own group of research. And we talk about a great paper published recently in Nature. The title is Steatosis Shapes Prognosis-Defining Liver Metastasis Heterogeneity in Colorectal Cancer. So first of all, congratulations for this fantastic paper. It's very original, this concept which is behind it. And that's the reason I would like to hear you presenting us what you did. So can you tell us what is the design of your study and how you came to this idea?
So thank you very much for the invitation. And so our study started from a very clinical observation, and that is in colorectal cancer, not all liver metastases grow in the same way and look similar under the microscope, but they present in different histological growth patterns. And one of them, the so-called replacement growth pattern, is associated with a much poorer prognosis. And we wanted to understand what drives this aggressive form of liver metastasis, and therefore we used the translational design. First, we analyzed patient cohorts with colorectal cancer liver metastases and asked whether patient characteristics were associated with the metastasis growth pattern. We then moved into experimental models such as organoid models or mouse models to test causality. And this allowed us to connect patient-level observations with mechanistic experiments in the laboratory.
And so what are the main results of your study?
So the main result, the most interesting result, is that a steatotic liver disease promotes aggressive replacement-type growth pattern of colorectal cancer liver metastases. In patients, steatosis was associated with a higher frequency of replacement metastases, and in mice, when we induce liver steatosis with a high-fat diet, this also increased the occurrence of poor prognosis replacement growth patterns, suggesting that the fatty liver is not only an association, but can causally contribute to metastatic aggressiveness. And mechanistically, we found that the fatty acids in the steatotic liver are used by cancer cells to stabilize the oncoprotein MYC. And MYC then activates proline collagen synthesis, and collagen works as a scaffold that allows cancer cells to infiltrate and grow within the liver tissue. And when we block key pathways of this axis, we could reduce the formation or the growth of aggressive replacement metastasis in our experimental models.
This is really fascinating, and to see that you were able to find one signaling pathway being impacted in this type of metastasis in the fatty liver. So now my next question is, so MASH is very frequent. Steatosis is 25% of the population. We know that this population is at risk to develop colorectal cancer, probably mediated by obesity in part. So in this situation, how do you see your work having an impact on the clinical practice?
I think the key message of our work is that the metabolic liver disease is or has consequences beyond the liver itself. Our study suggests that the steatotic liver is not just a passive background condition, but it can actively shape the behavior of cancer cells that arrive in the liver. And clinically, this has, I think, two important perspectives. First, liver fat could become a part of risk stratification in patients with colorectal cancer liver metastases. And secondly, it may also help identify patients who are more likely to benefit from therapies targeting MYC or related metabolic pathways. And basically, more broadly, our study supports the idea that precision oncology should consider not only the tumor, but also the metabolic conditions of the host organ, such as mesovial mesh.
That's a very important message. Not only the tumor, but also where and which environment these metastases are growing. Well, thank you so much for taking the time to share with us your thought about this fantastic paper, and I wish you good luck in your new location in Düsseldorf.
Thank you very much.